two things that make me excited. One is we are partnering with the World Economic Forum on data collection and actually putting together a platform. And so if you go to the end of the report, you can click through and it's global. It's not just US, and there's global data, and the plan is to continue on data collection going forward. So I think that's an important one. And then McKinsey is very privileged to work with clients across the spectrum. And so what we are working with is actually with each of our clients, sort of what is the way that we can enable them to also make these changes, right? So with health systems, for example, are there algorithms that can be baked into EMRs to flag things and make it automatic, so even if the physician isn't trained, they can route patients to the appropriate care? Conveniently, that is often win-win. I know we talked a lot about incentives, but this is a case where if women are being under-cared for, actually routing women to get the appropriate care, to get that, ICD or whatever it is that they need. Again, good for the woman, good for the system. Another example with health systems is encouraging to think more about menopause as a differentiator, right? Because women going through menopause may not be getting emotional support from their care providers. And if you can provide that how can we help health systems do that better? So that's an example on the provider side. And then on the pharma device side, I think some examples of things that we're doing is, again, very much using the data to say, I said this in the talk, but these companies may not know it, but they are women's health companies because their products are used and often disproportionately used by women. And so are they cutting the data in the right way to track those outcomes? And again, that actually avoiding that FDA recall saves money in the long run. So I think there are a lot of cases where the incentives do align, using real-world data for the medical device companies themselves to identify, hey, these are subgroups of patients that are on label, but for some reason, doctors aren't using this on that group of patients, right? I've heard even in interviews with doctors before, things like, well, they're not the right kind of patient. And that's very coded language for some things, right? But how do we actually use data to put in front of them that actually, yes, this patient is on the label for your therapeutic, they are the right kind of patient and they will benefit. So making sure that, again, that's teed up. So those are examples of ways that I think we're trying to put it all together with different players in the healthcare ecosystem.
We had the executive order on IVF that the president just released. And executive orders, I mean, they're great. I know there's a lot of hullabaloo about them right now, but essentially what they are is they are a directive from the president that says, my administration is going to make this a priority. And then they direct the different executive agencies to actually promulgate rules and regulations around that via statutory authority. And if they don't have the statutory authority, they go to Congress and ask for it. And so having the president with his bully pulpit put out a statement that IVF needs to be a priority and to make that affordable to families is crucial. And I personally think that a lot of the policies that his Domestic Policy Council are going to come up with, and I think it was 180 days they were given to provide policy solutions, are going to be on the employment side in terms of coverage and making things more accessible. And so I'm really following that closely. I'm interested to see what policies they come up with, and I'm interested to see how they structure it and whether they're going to try and use current authority that they already have, or if they're going to go to Congress and ask for this to be something that Congress, as a unified government, right now they have the presidency, the Senate, and the House are all Republican-led, and to see if that gets into whatever Congress passes, whether it's in the reconciliation bill or whether it goes through regular order. The other thing that I do for my clients is I look at who's coming in to the administration. And that's because the people, we've said it a number of times, at least I've said it a number of times, the people who are in decision-making places of power make a difference. And one of the people that is coming into this administration, likely, we haven't gotten a CMS administrator yet, but once that happens, we will likely see is a gentleman named Chris Klomp. And he is an investor and an entrepreneur in healthcare. He also sat on Maven's board of directors. I got permission to mention him when I was looking through public information about him to create like a biography to provide to clients. I read through the interview he had when he joined Maven's board, and I was almost brought to tears. He talked about how his father was an OBGYN and helped him and his wife through their fertility journey, and that every family, men and women, need to have a Maven to help them through their journey. And to have someone like that who understands the value in that, lead the Center for Medicare, which covers everybody over the age of 65 in this country, and really sets policy both for the government-funded healthcare and in the commercial market, since the commercial market often follows what Medicare is doing, is really comforting to me, right? He would report to the CMS administrator, who would report to HHS secretary, who would report to the president. I mean, that is a very close connection, and to have someone like that in that position, I think is going to be great. That is, women's healthcare specific, and I know there's a lot of uncertainty right now. But what I want to say about uncertainty in the government is that is such a great opportunity for the private sector to come in and provide some certainty. And I think it puts the onus on the private sector and employers to take a responsibility that they might not have felt before, because they felt, oh, the government's doing this. Maybe it's not our role. Maybe, as you said, your association said, this is not our role. This is not where we need to be. But it was very much their role and where they needed to be. And I think a lot of employers and companies and the private sector and investors are looking at their platform and saying, what can we do to advance women's health, and what can we do to help our employees, to help our family members, to help our communities. And I'm excited for the momentum that we have in this space. This is a bipartisan issue. There's a new Women's Health PAC that just started to raise political funds to say this is something that everybody across the political spectrum can get behind, that women's reimbursement needs to change, women's health reimbursement needs to change, and to try, as every year CMS puts out the physician fee schedule, that's what sets the rates. And so trying to change the physician fee schedule, Congress is about to address the physician fee schedule and maybe change it going forward. There have already been hearings on it. So to get in at the ground level and make sure that there's political will to make these changes, because that's where it starts. The physician has to have time. One of the things that I found so great, and why I still pay out of pocket for a very expensive integrative doctor, is because it's a 90-minute session where we spend the first 30 minutes just talking about what's going on in my life. And she takes that context, and then she looks at my blood work, and then she does the physical exam, and then she puts it all together. I think if women in this country were getting that kind of care through their insurance, and that was being reimbursed at an appropriate level, I think the women's health numbers would look a lot different in McKinsey's follow-up. I'd love to hear more about the data and how you're collecting it and where you're getting it from. And so in my practice, one of the things that I do is artificial intelligence, best practices, policies and procedures. And from a women's health perspective, we're really looking at artificial intelligence. We don't want to take the disparities that are currently in our health system and just put them into the data lake that we are then training all of these AI tools on. And so I see this as an opportunity to have a data lake that actually is correct and is not bringing those disparities into this new tech world. And so I'd be very curious, how you're collecting that data, how you're encouraging people to share that data, maybe something about interoperability. These are all the things that I do in my daily practice. Yeah.
When I'm feeling optimistic, I like to when I'm feeling optimistic, I think that AI actually will help us to be able to uncover the disparities in a way that we wouldn't be able to otherwise.
Yes.
And to be able to just look faster. So we can talk more. You're right. Interoperability is hard. And so a lot of this is piecing together different data sets. We use the IH&E global burden of disease data a lot to track and understand trends. And that does, track over time. So we'll be able to see that. But then there's all sorts of we can talk about US specific data sources separately. But there's other examples, like the list of essential medicines is an example where what is on that list and how does that correlate to the global burden of disease and how does that change? And so those are examples of sort of some of the things that you can measure for actions that are being taken.
You just triggered for me too. What you just said is beautiful and wonderful. I don't know if you would have said that at 25.
Never.
And with that, I think when I think of the workplace, how important it is, right, to be that role model for those that are younger women, because they're looking to you to say, how's she doing it? But to be real about it. I think that so much is we look at a pedestal, and we all look nice, and we woke up this morning, we got the best sleep, and we got all these things, but they don't see what was happening behind the scenes. And I think we need to be more honest in what that looks like but also giving them tips on what to do. And so to bring it back to, honestly, the workplace, that empowerment needs to happen from the top. But you need to make sure you have then the right benefits, transformative type of, cultural elements to do that. Because if you don't, we're never going to break the system. So I keep thinking of my girls. They're 10 and 6. I want them to have a very different life. But I think to myself, okay, they're my kids. But how do I now? Because I'm older now in the workplace. I used to be the baby. I'm not.
You're a decision maker.
I'm like, wait a second. I'm in my 40s. But if that's the case, how do I now influence the next generation? And I think that has to do with health.
I'm Samantha Borowski, and I'm one of the voices of NEBGH.
I'm Dr. Stacy Rosen, and I'm one of the voices of NEBGH.
I'm Rachel Snyder Good, and I'm one of the voices of NEBGH.